Hello, Colin Hung here for Healthcare IT Today, and I am here at RSNA 24 in Chicago, Illinois, and I'm about to sit down with Dr. Bizzo from the American College of Radiology. He's going to talk to me about a very unique program that they're running at ACR around AI and validating and proving its value to radiologists. They're essentially doing something that I think is going to really help establish confidence and identify places where AI can truly be useful for radiologists. Let's get to it. Dr. Bizzo, welcome to the program.
Thank you, Colin.
Before we dive into talking a little bit about the future of radiology as you see it, can you tell me a little bit about your background and your role here at the ACR?
Yeah, of course. I'm a trained diagnostic radiologist. I'm Associate Chief Science Officer at the American College of Radiology Data Science Institute. And I lead a lot of our efforts with the clinical use of AI at National Brigham in my part of my role there at the AI business with the ACR. There are a lot of very exciting efforts with the Arch AI program, with Assess AI, and how we're really preparing ourselves for this upcoming wave of generative AI.
Yeah, I mean, I have to say, being here at RSNA 24, you can't walk 10 feet without seeing something around AI.
Right.
AI seems to be everywhere in here. What's the kind of work that you're doing with the ACR around preparing the practice for, or the industry for AI in radiology?
Yeah, there's a lot of work happening. We are very excited with the Assess AI program. That's for post-market monitoring of AI tools. We are live piloting narrow AI applications for 2 use cases at the moment with 15 pilot sites, really looking at how well these tools are working in real clinical workflows. So that's what's happening today. But at the same time, with this new wave of foundation models, where instead of looking for specific findings on an image, some of these tools can really do a very comprehensive assessment, such as drafting an entire radiology report. So we are really working in preparation for those new activities where draft reports can be assessed in the same framework as we're establishing with SSAI, and help identify how those new tools can help increase radiology efficiency.
I was going to say, so is the work really to validate the claims being made, or is it really just to validate that AI can be helpful, or find ways, the method that the AI can be deployed that can be helpful?
All the above.
All the above. Okay.
The bottom line is that there's a lot of AI being used, not a lot of AI being monitored. So we look for how the end product of radiology, the reports, agree or disagree with AI predictions for those cases. And other aspects such as the quality of the exam as reported, the certainty of the radiologist in that report, and that allows an analysis of reasons for why that model may be working or not so well in specific institutions, as well as regionally and nationally in the AI registry that the ACR has set up. So it's an effort that really helps AI in practice continue to be safe and effective.
And it sounds like really to me that, the work that you're doing is really to build confidence, or will build confidence from radiologists on AI, right? Because once you're able to validate and prove that it works in this way, they should be able to be more confident to adapt the AI in their own practices.
Yes, absolutely. And the way that a lot of these tools get regulated today to be used clinically is very focused on a specific time point. The current regulatory framework with the FDA really tests those tools using special controls, and those tools are tested before entering the market. After entering the market, there are regulatory aspects, but in practice, we know that some tools work well or not so well in our local institutions. So having ways that these tools can be continuously checked by local validation with local experts really help make sure that these tools are working as they should be. And especially in this new wave of generative AI, we recently launched a new initiative that is very exciting, that's getting a lot of attention here at the show, which is the Healthcare AI Challenge. So we can do that in a way that we test how these generative AI tools work for tests like drafting an entire radiology report, and healthcare professionals, ACR members, and health other participants of the network that we established and which is also open to the whole community, can see how these tools work, see how they perform compared to their clinical skill level as a radiologist, as a fellow, as an attending, or a student. And that information can help drive insights, can help with decision-making for institutional implementation of these tools after they are regulated, or also to inform the public about how these tools should be better enhanced to fulfill clinical needs.
As you look across in your position at the ACR and at Mass General, is there anything on the horizon that has you excited for in terms of technologies or in industry developments?
Yeah, for sure. And exactly this point about the generative AI tools, the foundation models, and how we can move from the current status, very specific findings being detected by these tools, to very comprehensive analysis, such as drafting a report, summarize the patient chart, or looking for multimodal data that's really going to change how AI is consumed today, and hopefully help with the increased demands on radiologists. There's so much work to be done, and the rate of increase of supply of radiologists is not moving as fast as the demand. So these tools, hopefully now, will help bridge that gap. And hopefully also the healthcare AI challenge will help inform regulators about how these tools are working locally by experts. And hopefully that will pave the way for these tools to be more quickly regulated and available for clinical use.
If I was a radiologist who maybe wasn't as deeply involved in the ACR, what message would you give me to motivate me to get involved?
Well, please try to be informed, try to please reach out. We are open to your thoughts. As a radiologist, I know that it's overwhelmed with the amount of information that's reaching us, and we are better embracing the technology, and technology needs subject matter expert as radiologists to really be on the front seat of how these tools are being used, how these tools are being tested. So please engage. We need your help to help the whole community better use and understand the strengths and weaknesses of the technology, and help, of course, our patients, which is the most important thing.
Dr. Bizzo, you shared a lot of great information today. Where can people go to learn more about ACR?
Well, of course, the ACR website is acr.org. We have the AI Central website through the ACR portal, where we have information about the FDA cleared devices. We have the Data Science Institute website and the Healthcare AI Challenge.org. So all those are resources for the whole community to learn more about the work we're doing with AI at the ACR.
Well, Dr. Bizzo, thank you so much for taking time out of your busy day to be with us today.
Thank you, Colin. It's a pleasure.
Really appreciate it. Hey, I really want to thank Dr. Bizzo for coming on camera with me and telling me all about the fantastic programs that they're running here at ACR. I think, what they are doing is really akin to something that Ontario MD was doing, and something we covered earlier on Healthcare IT Today, where they're basically proving and validating all the claims that vendors are making around AI, and doing the work and the research, frankly, for themselves to really determine as an industry, where can radiologists best benefit and truly benefit from AI. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Plus, you can always head over to healthcareittoday.com, where you can find more great content like this. I'm Colin Hung here in Chicago, Illinois for RSNA 24. Thanks for being here, and I'll catch you on the next video.